Yes. Are you able to see now?
Yes, yes.
Okay. Yeah, your time starts now.
Okay.
Everyone, please mute yourself. And Dr. Nedha, whenever you're ready, we can start. You have another 30 seconds left for the first minutes. Everyone, please mute yourself.
So can we start? Hello.
Hello, yeah, can you hear me? Yes, we can start.
Yes, yes. Yes.
Yeah, I know there are a few restraints, but then it'll be better if you can switch on your video for the communication stations because even body language is very important when you do a communication station. It's up to you completely, but then just a suggestion.
I'm so sorry. My cam is not working. I'm from mobile. So
Yeah,
I'm so sorry for that.
it is just a suggestion for everyone because even your body
Yeah.
language is important when you're doing a communication station. So anyone who wants to practice communication, you'll have to do it in person or with your video on. Okay, so we'll
Yes,
start.
I'll take care. Yes.
Okay. Before I start the timer, I'll just tell you a background thing that I'm only using my phone. Okay, like I'll be the role player. I'll be Anne, 15-year-old Anne. I am using my phone. You'll have to start from there. Yes?
Okay.
Okay, sure. Yeah, your time starts now.
Good evening. Good evening, Anne. Um, can you please put your mobile for a while so that we can talk?
Why, doctor? Why should I put my phone down?
Okay, because it is something very important regarding your health, Anne.
This is also very important, doctor. I'm texting all my fans. I'm very busy with my Facebook vlogs.
Yes, I know. I have heard you are a very famous blogger, but I need your 9 minutes only. Then afterwards, you can use your mobile. It's a kind request.
Uh, what is it about, doctor? Let me decide whether I need to keep my phone down or not.
And this is about your health, the condition in which you arrived last day in the emergency. That is about that. It's really
Okay,
important.
yes, you tell me.
And please, can you put your mobile down?
Okay, doctor, tell me.
Thank you so much. Um, and this is Dr. Nida, one of the doctors working in this hospital, and I'm here to talk to you regarding your health and regarding the decision of admission in the hospital. So, do you do you know about that?
Yeah, my health is completely fine, doctor. I know it's my health, no?
I really feel happy that you are feeling quite well. But yesterday, what happened when you arrived in the emergency? You were in a very bad condition. Your heart was weak. Your pressure in the blood tubes were very low. Your condition was very bad. Are you aware of that?
I just skipped a meal, doctor. Maybe that's why I felt a bit giddy, but then I'm completely fine now. I can go home now.
Uh, um, it's quite good to hear that you are feeling good, but actually what the thing is that, and we have to admit you because we have to monitor some salt and sugar levels in your body, and your blood pressure and your heart rate, we have to monitor. That's why we have planned the admission.
No, why, doctor? I'm telling you, no, I'm feeling completely fine. I'm healthy. You don't have to get worried. Just discharge me. I need to go home. I have so much works planned for today. I need to go and take care of all that.
um, and what about doing your work from here, from the hospital? What about that idea?
Oh, no way. I'm an influencer. I have so many fans in Facebook and Instagram. I have a Facebook live even today evening. I need to go prepare for that. I need to dress up, everything. You cannot tell all that to me, doctor. Just discharge me. I need to go.
And what if you again faint, or what if you faint in front of the Facebook live?
That won't happen, doctor. Like I said, I'm very healthy. I'm fine.
Yes, I agree. But yesterday you fainted and you landed in a very bad condition, Anne. And whatever work you want to do, we can help you in that regard. We can involve the social service. They can brought your setup over here. Uh, we can help you in that. In that, you can continue your work from here.
I
What
don't
about
need
that?
social services, doctor. I need my team, everything. You guys are not my team at all. You all work in hospital. You don't know anything about what work I do.
But we can ask our social service to bring up your team over here. Some members can come over here, and then they can do whatever your program is. But your admission is really necessary because we have sent some tests, and we will be monitoring your heart rate, your blood pressure, and we will be starting meal in a stepwise manner because your body was not taking healthy meal for a while. So we need to start that in a gradual manner. Am I making myself clear,
So you
Anne?
promise me not eating, isn't it, doctor? Don't worry. Give me a full meal now. I'll eat it in front of you. I'll go home. I'll take photos of me having good meals and then send you pictures. I can even tag you on Instagram, posting my meal photos. I can definitely do all that, but I just need to go home now. I don't even have time talking with you. I don't know why you are not able to understand how busy I am.
I can understand, Anne, I can see you are agreeing for taking your meal, but you see, when our body is not taking a meal for a long time, then we cannot give our body a large meal at once. We have to give it in a small steps because it will be very disastrous for your body. Um, are you getting me?
I don't know, doctor. I'm telling that I'm fine, and then you're telling me my body is a disaster. You're really funny, doctor. I don't know what else to tell.
I'm sorry if you feel like that. I'm not saying that your body is a disaster, but like eating a full-time meal just now will be not good for your body. That's
Three
what
minutes.
I was saying. That's what I was saying.
And you're telling that I should eat, and then you're telling that if I eat, it is not good for me.
You should eat, and but in a stepwise manner, because your body was not taking meal for a long time. That's why your body is not ready to take a large amount of meal at one time. Really, we got really worried when you presented to emergency last day in a very bad manner. We did a lot of things to make you stable. Are you aware of that?
Yeah, my mother just told me that I became a bit giddy, and then you guys gave me some fluids, and then I got better. I don't know. That happens time to time, no? Even for other people also it happens. I don't know why that is a big thing. Anyways, you want me to eat, you give me a diet plan. Tell me what to eat when. I can definitely do that if that's what you want me to do at home.
Yeah, I can see you are cooperating with us, but see, and we can't discharge you at home now, and I have already mentioned you that we can bring the social service and they can help you regarding your work and um, we need to monitor your condition because your heart was really weak last day and your blood pressure was really low. We were quite worried. We did a lot of things to stabilize your condition. um, so are you agreeing with me?
Doctor, I don't want you to make decisions for me. I am big enough. I am an adult to make decisions for myself. I mean, I have so many people who listen to me on media. I don't know why you think you need to make decisions for me. When I say I don't want to get admitted, I don't want to. Just sign my discharge papers. I'm leaving now.
Your parents have agreed for the admission, and
My parents are also not decision makers for me, Dr. Nida. I am an adult. I can make my own decisions. Why do you expect my parents to decide for me?
um, um, in these situations, we have to follow the wishes of your parents. And my hands are cuffed. I really cannot. I'm not allowed to discharge you. But in the meantime, I can arrange a meeting of you with my consultant if you have concerns regarding admission. This I can do.
I don't want to talk with anyone else, doctor. What else are they going to say? They're going to say the same thing that you're talking.
Is there any other concern why you don't want to stay at the hospital?
Time up. Yeah. I don't know. I'm sorry. I was probably a very tough role play.
At the end, till you were not convinced by me.
Really interested.
Yes, Dr. Kabir, you have something to add?
Hello.
Yeah.
Oh, thank you so much, Doc. I'm just amazed. This very interesting session. The role player was very much good. Um, Dr. Nida, thank you so much for the attempt. You are very affirmative and also very persuasive. Yes, you were trying to be empathic. I think that was a very good one. Um, but maybe you should have tried and bring more other options for her to look at. And even at the beginning, you could have get a better rapport by telling her that it's okay. You can have the conversation with the phone, with her on the phone. That's fine. She must not keep the phone away, or you might just maybe tell her that it's okay if you want me to give you some time with your phone. After that we can discuss. Anyway, she was a very difficult patient, very, very difficult teenager. I think you did well, but maybe what you should have done is to explore more reasons of why she doesn't want, which you tried to do at the end. Unfortunately, time did not allow, but you did very, very well.
Yeah. So let's hear from Dr. Nida first, how you felt to like
Thank you, Dr. Kabir. But I wanted to, I have read and I have seen in the scenarios that if the teenager is working on mobile, then you have to ask. But it is a pretty good idea that you are saying to make up a good rapport. We can even talk with phone. And I wanted to know what I would have offered more, or what I could have explored more. I wanted to know your feedback.
okay, yeah. If anyone else has anything to add, or I can go
Ma'am,
on to
can I add something?
yeah,
Like
Dr.
Dr. Nida could have said, do you think, and there's anything more important in this world than your own health? So I'm just asking for 9 minutes of your time so that I can talk about your health. Is it something that you can say? And another thing I wanted to say is like, at no point Nida actually shared the diagnosis that she has made about Anne, about the diagnosis of anorexia nervosa, and whether to check her knowledge if Anne knows anything about this condition and how fatal and how dangerous it could be.
Yeah,
So
yeah. So I have all those in my feedback which I'm about to give. Is anyone else anything you want to add, or we'll go on to okay. So Dr. Nida, overall it was very nice. It was structured. You tried to convince the patient as much as possible. Everything went on very smooth. So you introduced yourself. You didn't start talking until she put the phone down, which is actually very nice, because you need her full attention when you're talking, because this is actually a serious thing to discuss. And then you tried to develop rapport, but then she didn't show much interest. But she was, and you were persistent, and she actually got convinced, which is good. And then when she asked what did you want to talk about, you did tell that you wanted to talk about the patient's condition, Anne's condition. Yes, but then probably you should have told at that point itself that you're thinking that she has some problem that you call as anorexia nervosa, and do you know anything about it? So that would have probably distracted her to start listening to you, because you're telling a new term, and that would have put her into confusion. She would have started listening to you. And you didn't usually we'll ask if they need anyone else, and which you didn't ask, which is good in a teenager. You usually won't ask whether they need anyone to accompany them, because they all think they are adults, they can make good decisions. That's how I reacted also. Why are you making decisions for me, Dr. Nida? I am adult enough to take decisions. I don't need my parents either. That's what I said. So then you did ask her, do you know what happened yesterday night? And she said that she just felt a bit giddy. That's just her perspective of the whole thing. How she's trying to put it is that whatever happened is something small, and that it has happened before. From whatever she said, it has happened before already. So then you went into the actual topic, and like others said, you will have to tell that you are thinking that she has what you call as anorexia nervosa, and then you'll have to explain a few words about it. Yes. And then, so every time she insists, usually in communication, there are a few things what we call as hidden agendas. They will have a few points that they will see how you react to and how you act upon, based on which they'll be able to assess whether they can give you the full marks for each of the subdivisions or not. So those hidden agendas you will have to address. So one of the hidden agendas here was that she is a big influencer, and she has to go to a Facebook live. So when she said that, you said that you can arrange for the team to come here, you can involve social services, which is actually a good thinking, Dr. Nida. And then she says that she can even follow the diet plan at home. Where she got confused is that maybe at the start itself, you should have told like why you need her to get admitted is because you cannot start whatever food right away, because that's what you want her to do, isn't it? You want her to eat, and she says, "Give me the food. I can go out and eat the full meals. That is okay." But then you want her to get admitted because you want to observe by giving little food, and that nutrition recovery syndrome. You don't want that to happen. So that had you said that at the start, I want to ask, why do you want to, why are you confusing me? As in, you want me to eat and then you don't want me to eat. So that was, but that part was there. And then one more thing is, when I said you can like send me home and you can give me a meal plan which I can follow. That is actually an alternate which I expected you to tell. Since you didn't come up with it, it was like prompting you to catch that point and start talking about it, because when you see like it's like for each communication there are like branches. If the scenario goes into this, or if the scenario goes into this, or if the scenario goes into this, and how you deal with each of the branches. So one is the patient is refusing admission. You'll see whether the case is stable now or not. Though she presented sick, she is stable now. So even if she refuses admission, you can think of home therapy, residential therapy, or family therapy. You can even have a nurse go home and keep monitoring her, maybe once or twice a day. So that option you could have given. And then and then when she kept insisting that she wanted to go home, she wanted you to sign the discharge papers, you probably shouldn't have brought the parents. Teenagers, they feel that they are the decision makers. They don't want anyone else to make decisions for them, which I had already commented also. So that will like won't reflect well on what you said. And one more thing that two more things that I felt was, one was you repeated the same phrases again and again. I understand. I know what you're going through. So with teenagers, usually the cash phrases are like are different. Like what you said, I know you're a genius. I know you're very famous. I know who I'm talking with. I'm very happy that I'm talking with you. So when you use those phrases, it actually elates them, and they'll think of start to listening to you. So those few things can be done. And then one more thing is you kept repeating like multiple times, probably four or five times, that yesterday you fainted, yesterday I had to recover. For every question that she put, the answer became repetitive. I hope you're understanding, Dr. Nida, what I'm trying to tell you. You'll have to use different phrases. I know it's the same question. I know it's all put, jumbled sentence, but then for 9 minutes you will have to sit and talk, so you will have to use different phrases, different things. So it's like you shouldn't let go everything that you have in your basket. You'll only put one one egg into her basket and then wait for her to respond, and then the next one. Once you use up everything, you cannot stretch the whole thing for 9 minutes. Yes.
I got your point, but I wanted to ask, you are saying that if she is not, she is repeatedly refusing, then I should have, what she was trying to say, that I go home with a meal plan. So I should have agreed to that plan.
No, before I asked, you should have offered those alternative treatments, because patient is stable now and refusing admission. We can offer alternative treatments like residential therapy, because you need her to get treated, isn't it? If patient is
Okay.
unstable, you obviously won't let them go. Like I said, there
Sorry.
are branches to a single stem. So if the patient is refusing admission, you'll have to see whether the patient is stable or unstable. And then if the patient is stable, you can obviously offer them alternate therapy. That's as per guidelines also. I can share you the guidelines also.
Ma'am,
In-
can we tell her about the different color codings that we use to grade these patients? She's actually in the red zone with a BMI of
yeah,
12.
but that has become more like jargons because you're dealing with a patient. And Dr. Nida also tried to avoid all those jargons here. So When you're talking with a nursing student or a medical student, you can talk about all those things. But then here you shouldn't use those.
But she's not understanding the gravity of the situation. So, is there a way in which you can convince her that she's at a life-threatening stage? So, what better way to tell her than, like, is there any other better way to apprise her of her situation, which she's
Yeah,
not able to apprehend?
usually with difficult teenagers, you cannot convince them with reason. The STEM itself is like that only. You'll have to convince them by going through, in their way only. So how you can tell is you want to do a Facebook Live, but imagine how you will be when you become very thin. You lose all your hair, you lose all your nails, your skin will shrink and wrinkle. You won't look good. If you tell all that, then they'll get scared and they'll get convinced. But when you talk very medically, they don't answer to reason. Teenagers. That is why this scenario was put, because it is very difficult to deal with this scenario. Difficult teenagers, difficult colleagues, and these are very commonly given scenarios also. Recent recalls all have difficult teenagers, all have difficult colleagues.
Excuse me,
Every sentence, at least one of the 4 communication scenarios is difficult colleague or difficult teenager. Yes, Dr. Kabir, you wanted to say something?
Yes, thank you so much. I want to ask for clarification.
Yeah.
Okay, yeah, this child is this teenager is a 15-year-old, and according to the UK guideline, a 15 regarding consent, even though she's really competent, she can only accept treatment. She cannot reject treatment until when they are 16 and above. So Dr. Nida, she mentioned she will involve her consultant and other seniors to speak to her, but the teenager refused, and the parents have already agreed for the admission. So how do you continue the conversation? Since legally she cannot refuse the admission?
Yeah, like you said, we can see whether they're legally competent or not. Yes, but then by law, you are forced to treat her only because they cannot refuse treatment. That is also true. So there is something called sectioning a child or a patient or a teenager's decision when their parents have already consented to treatment. That you will involve the court. You'll have to get a court order because of their age group, and then you'll have to proceed with the treatment. So that you can put in also. When you say I'm forced by law to keep you in the hospital, I will have to proceed with getting a court order. That will also scare them. Because teenagers, they don't know what's happening in the outside world, isn't it? So that is also scary for them.
Will a court order be required at age of 15? Because she's at an age when she can only consent for treatment, as doctor has said earlier, but she cannot reject since her parents have agreed. So is a court order warranted in this situation?
Yeah, when you want them to get admitted and you want to reason with the teenager. Yes, Dr. Tanushree. Because like I said, that is what is called sectioning. When you section a patient's decision when they are like competent enough as per law, GILIC competence is there, then you will have to involve the court. That is called sectioning. By law, you can supersede their refusal to treatment and can actually start treating them.
Okay, thank you.
Yeah, thank you.
I have one question. Excuse me.
Yes, Dr. Murshida.
So in some scenario, if there is something like they are doing with the mobile, so how should proceed if they do not want to concentrate to the, yes, so the same situation. So ideally how it should be proceed.
Yeah, so when I'm just sitting and using my mobile, you try to grab my attention. Hello, and how are you? I say, like, for example, if I'm the candidate and the role player is sitting opposite to me, and the role player doesn't respond to me, and then I'll say, I just now heard from my colleagues that you're a very popular person. I'm very proud and happy to talk with you. When you say that, that will definitely grab their attention because they
But
want
it
people
is,
to.
so it would be written in the the question paper that she is very popular. Something I have to know before now.
Yeah,
So
yeah.
it should be mentioned.
Yeah, the stem showed that she's an influencer.
Can you please give the stems again?
Yeah,
Because
sure.
maybe missed something.
Yeah, it was written in the stem. I didn't use that in the beginning. I should have encouraged her, like by praising her.
Yes, yes. That's what I said. No, you'll have to tell that you're very popular. I'm very happy, and I feel very proud that I'm talking with you. Only those will impress.
It's an honor. It's an honor for me to talk to such a famous influencer, something like that.
Yeah.
Buttering.
So here it is. She limits her food intake as she feels she has to be thin as an influencer. It will usually be mentioned in the stem. So that because they also want you to pass, isn't it? So they'll give you something to deal with the whole thing. Okay.
Thank you.
Thank you. So I'll just go on to the mark sheet. I'll just quickly do this and then go on to the next one. So information sharing and accuracy of information. Yes, I can I can give you meet standard because you said all the what are the adverse effects if the patient doesn't get admitted, and you also said how you will start the food, how what all you will monitor, everything, all that you said. You also tried to reason with whatever she was telling. So I'll give meet standard for that. Rapport and communication style, I felt because I felt that your answer was quite repetitive, probably about 3-4 times. And I felt you got stuck in between here and there, maybe because I kept refusing and you didn't know what to do. But then some of the role plays will actually be this stuff. So that alone will be borderline. And then verbal and listening communication skills, that was good. You said, I understand. You said, yes, I know what you're going through. You even said, I know you're a very famous influencer. So all those put together, I can give you meet standard. And then managing concerns and agreeing next steps. We never came down to agreeing next steps. So I think I'll give you borderline there. So yeah, still very good score. 6 out of 8 is actually a very good score in communication.
you.
Especially when you have such
Thank
a
you.
difficult literacy or role play. Yeah.
Thank you for
Uh,
such informative scenario.
Yeah. Thank you,
yeah,
Dr.
doctor, can I ask again one question?
Yeah, sure, Dr. Moshida.
So for the scenario, what I get, that child is required, I mean, she is fainted at home. So I
Yeah,
think
yeah.
we should be very much strict on admission or not, because she fainted, it means hypoglycemia and many things that is not mentioned in the scenario. So I mean, when child said that, no, I will not admit, in that time, should we say that, yes, you have to admit because of this situation? If you not agree, then we have to talk with the team. So they will take their decision. In this scenario, in this situation, you should not be denied for admission. Should we go very strict or not? As like it's not mentioned that what is the calcium level or phosphate level or blood sugar level.
Okay.
So
So in anorexia nervosa, one of the causes for becoming unconscious is even becoming bradycardic or even becoming hypotensive. So that's what was mentioned here. The patient became bradycardic with BP at lower limit of normal. She didn't become hypotensive, but then she was bradycardic. Most of the times they'll be stable with bradycardia because it has been, it's a chronic condition, isn't it? Anorexia nervosa. So your body will adapt to it. But then all of a sudden, there can be fainting episodes, and that's what happened with her. So when you want her to get admitted, when you're making the decision that you want her to get admitted, then you will have to be firm. You cannot be strict with teenagers. Like they won't listen to being strict. You will have to be firm with them and tell that this is how it is. And like I said, reasoning with them won't work. Like telling that you want to like admit them for specific reasons won't work.
understand.
We
I
have
mean,
one.
I can say that you can meet with my consultant, so that
Yeah.
so it could be one options maybe.
Yes. You can definitely, you should definitely mention that you want her to meet with a consultant. And you should, it will be better if you also mention that you're forced by law to retain her because she needs admission. Anyways, we have also another mentor, one of our other mentors here joining us today, Dr. Prasanna. You want to add something, sir?
Yes. Can I add to one point to that question, Asha?
Yes, sir.
Okay. See, that was a very good question. But basically, what if it is going to be a difficult colleague, or if it is going to be a, teenager, you just see what is their understanding. So you just ask this question. So what is your understanding of the problem? See, you just ask this teenager what do you know what will happen to you if you are not going to get admitted? So see how her level of understanding. So she may tell, okay, my the one other friend of mine had a severe problem. He was into the ICU. Or you can even tell her that if you are not going to get admitted, you may end up with some serious problems. For example, it can cause disfigurement or something like that. You just give a mild threat to them. You should not threaten in a very blatant way, but you just threaten them in a milder way. You may miss a lot of school time, or you may miss a lot of Instagram, or you may miss a lot of something which they are dear. So if you tell that word, then they will tell, okay, so if I'm not going to do this, then I will miss this. Okay. But if she is still adamant, if she says that no, I'm not going to get admitted, come whatever you do, then comes your sectioning or court order or your competence, all those things. So so first point is, you just clarify the role. You check her understanding level. If her understanding level is in the positive way, then you can definitely think that the agenda is going to be closed in a nicer way. So if the understanding is not in a positive way, then you have to end up in the sectioning way. So that is one most important point if you're going to deal with the teenager.
Understand.
Yeah. Okay.
Thank you.
Thank you.
Can we say to her that, see, Anne, you have restricted your eating to such an extent and for quite a long time that even if you start eating normally now, your body might show some abnormalities which could be fatal, something like that?
Yeah, your body can show some abnormalities, and you may end up more sick. You may become drowsy, or you may faint. Do you want all these to happen? So you can put in that tone. I don't want all these to happen to such a good influencer. So if you put in that tone, then it's all not a communication scenario is not about knowing the nitty-gritty of the disease. It is about how we bring up the person who is sitting opposite onto the table. That's all. So it is how we talk, and we should bring them into the table. So you should not use jargons. You should keep those rules simple. You should not use jargons, and you should use simpler words, shorter sentences, and you should make them agree to your plan. So that's all. That's about simple about the communication station. So you should see or check a level of understanding. So as you said, yes, if you put it in a mild threatening way like that, and she will agree, then you should go ahead, and you should finish the station.
So, sir, I have a question. One question,
Yeah.
please.
Yeah.
Yeah. So what if what if we come to the point when we have to do the sectioning, and
Okay.
how do we say her that about the court orders that she doesn't get offended on this?
Before the going to the court, if it is going to be a teenager, then you have to tell that maybe I have to talk to your parents. Maybe I'll have another meeting with your parents, and then if you want, we'll all sit together and have another chat. So first finish with the parents, And if still she says, I don't want my parents, you can do whatever you want, then maybe I should talk to the higher officials in the hospital. Maybe they may involve the police, or they may involve some law, so that we have to force certain things on you. I don't want that to happen, but still, for your good sake, for your health, which is very vital for all of your followers who is following in the Instagram. For all those things, I need to take up I may need to take up this action. So you can put it in that way. Is that okay?
Okay, thank you.
Yeah.
Yes, sir. Thank you.
Thank you, Asha.
Thank you, sir.
Harsha, only one doubt. Did the doctor introduce herself in the start?
Yeah, not
You
in the start,
discussed
but
it?
as soon as I kept the phone down, she said, I'm Dr. Nida. I've come to discuss about your health.
Okay, okay. I joined late because it's a very tricky situation actually. Initially, they don't talk at all. So making them talk is the first priority. Then suddenly we get lost into that introduction and rapport part. We should make sure that we go back before entering the conversation. We introduce ourselves, try to clarify our role. I think that's important because we get suddenly tensed that she's not talking at all, and we try to go into the subject straight away. So make sure that we do the initial things right before entering the topic. That's all. Okay, ma'am. Thank you.
Sir, I have a question. Can I ask, please?
Yes, ma'am.
Yes.
So we've heard that in conversation with a teenager, we shouldn't say that I am Dr. Blah blah, because we should say that I am Nida, and just to make just to make her more comfortable with us. Is it true?
Uh, no, you will have to say that you're the doctor there, isn't it? So that she'll respect your decisions. She has to know that you're the decision maker. That part you cannot compromise. You'll have to say that you're Dr. So and so, and that you've come to talk about her. If it is okay to sit and talk for 9 minutes, you can even time me. I'll finish in 9 minutes because anyways your station gets over in 9 minutes, and then you can proceed. You don't have to ask for anyone to accompany her because she thinks that she's an adult, but you will have to say who you are.
Okay. Also, is it true for in the case of colleague, if we are going to give an information scenario with to our junior colleague, so in that case, we shouldn't say a doctor. I mean, there was some case in which they prohibited to use the doctor word.
I don't think so because you have to clarify who you are, isn't it?
Okay.
Yeah, you should
Okay.
always say who you are.
Okay. Thank you. And in the case of the teenager, sorry. Yeah, in the
Yeah.
case of the teenager, should we say that shall we go ahead, or you want us to wait for someone? Should we say like this, or we shouldn't even at all ask her about any attendee?
No, how you can put it is, I hope you're fine attending this meeting alone. If at all you want to talk about that, the maximum you can do is, I hope you're fine with attending the meeting alone or talking with me alone. That's how you can do. You cannot like ask them whether they need someone else to be with them. It affects their ego, so the way they respond to you will also change.
Okay. Okay. Thank you so much.
Yeah, thank you. Okay, I think that was a very nice discussion that we all had with inputs from almost all the mentors of our group target MRCPCH Clinical. There are a few chats that I'll read through if anything needs to be clarified from the chats also. Okay, I think it was all just discussion of what we are already discussing here. Okay, so if everyone is okay, we'll move on to development station. Is the volunteer, are you ready? Are you here?
Yes, I'm here. I'm ready.
Okay. So we have Dr. Balaji as our role player today for the development station. I'll just
Okay.
share the scenario.
Okay.
So you'll have same 4 minutes, but then if you finish earlier, then you can even tell me we can start. Yeah, your time starts now.
Okay. Mhm.
Okay, we'll start.
Okay. Can I start?
Yes, yes, your timer has started.
Okay. Hello, my name is Dr. Kabir. I'm one of the children's doctor. Am I talking to the father of Salma?
Yeah, doctor. Hello, doctor.
Nice meeting you. How may I address you, please?
You can call me Ali, doctor.
Okay, nice meeting you, Ali. I understand. How did you come here? Hope there was no stress on the road.
No, doctor, it was okay only.
Okay, that's nice to hear. I understand you have concern regarding Salma's speech. Is that correct?
Yeah, doctor. Yeah, she has been not speaking that well like other kids. I'm really worried about that. Regarding
Okay.
that only I have come.
Okay, so thank you so much for making that effort. We are all here to support you, and we'll see how we can help Salma. So please, I would like to ask you some questions regarding her overall well-being. And during this time, I would like to write some notes, after which I will proceed to assess her. Will that be all right with you?
Yeah, doctor. Fine, doctor. That's okay.
Okay, thank you so much. So please, in your own words, can you tell me what's the main concern?
Yeah, doctor. She has not been speaking like other kids. So other kids at her age are speaking well, but she is not like that. That's why
Okay,
I'm worried, doctor.
okay. Since when did you notice this, please?
So for the past 2 years, it has been like that, doctor.
Okay, like how much is there anything before, was she able to talk more? Now she cannot talk.
Yeah, doctor. Previously, she was better, and all of a
Oh,
sudden, it worsened. And
okay.
from that last 2 years onwards, it's not improving much. I've been
No,
doing some therapies, and but she is behind actually.
no, I'm so sorry to hear that. That must be very difficult for you. Okay, so please, I want to ask you some screening questions regarding her development, if that's all right with you. Do you have any concern regarding her vision or hearing?
Vision, no, doctor. She sees well. Hearing also, sometimes maybe she doesn't turn much, but otherwise, we have not done any testing or so.
Okay,
But,
okay. So, do you mind telling me how many languages do you use at home?
yeah, doctor, I speak Arabic, and now we have moved to UK last 9 months. So Nanny
Okay.
is taking care of her. She speaks English,
Hmm.
a bit new language only. She's trying
Okay.
to learn.
I see, I see. Do you notice like Salma, she prefers to use one side of her body more than the other side if she's working or talking or using her hands?
No, doctor, she is using both the hands.
Okay, okay, that's fine. Okay, please, I would like to take you back to as far as when she was born, if that's all right with you, so that we'll know what's wrong with her. Okay, so if you can remember when the mother was pregnant, was there any problem with the during pregnancy?
As far as I remember, nothing, doctor. It went well. We went for regular checkups. Scans were good, and they
Okay,
even gave medicine. So everything we took, everything went well only, doctor.
that's great. So there was no any infection for the mother that she needed treatment?
Yeah, doctor. No, she didn't have any fever or anything. She was fine.
Okay. Okay, that's reassuring. Okay, so during the birth, was she up to term? Was she 9 months or she was but
Yeah, she was term doctor. She was like 6 kg. She was healthy. She cried. Maybe she had some jaundice. So
mm,
for that 1 day, I think they kept phototherapy, the
oh,
tube light therapy they gave.
okay.
Otherwise, everything was fine, doctor.
Okay, okay, that's reassuring. Did you mention that she was 6 kg at birth?
Pounds, doctor, 6 pounds.
Six
She was.
pounds. Oh, okay, 6 pounds, that's fine. Okay, so during that admission of her for the jaundice, what did she receive any antibiotics or any medication? Oh,
Nothing like that, doctor. Nothing.
okay. So after the admission for the jaundice, did she had any follow-up? Was there any other issues?
Nothing, doctor. Regular checkup only for the vaccination and
Mm,
weight. She was doing well only, doctor.
okay, that's great. So during birth, usually they do this newborn screening. They do Hill's prick screening. Did they do for her? It was normal?
Yeah, doctor, it was normal. They even did the hearing checkup that time. It was normal.
Oh, that's great. So they did hearing and it was normal. Okay. So after the jaundice, there was no time she had another hearing test again?
No, doctor, only once we did.
Okay. That's great. So did Salma have any other medical condition?
Yeah, doctor, I think at 2 years of age, she had a bad fever, and
Mm,
she had some convulsions also. So she was bad as shape. She was admitted in ICU. So 2 days, then whole 2 weeks we were in the hospital only, doctor. They said some brain infection. So she was on antibiotics. After
mm,
that only I feel, doctor, this whole delay is there.
I'm so sorry to hear about that. That must be very difficult for you. I'm so glad you are still here fighting for her. Okay. Do you mind, do you remember the antibiotics that was used during that infection?
No, no, doctor. They gave it through the blood tubes, but I don't
Mm.
remember the drugs. And also, she also keeps getting frequently this ear infection, doctor. So we give
Oh,
oral antibiotics for that also.
oh, okay, I see. So how many doctors are now seeing her? How many teams of doctors are currently seeing her?
So, doctor, when we were in Middle East, I think we were showing to neurology doctor and also the speech therapist. Not
Mm,
so regularly. The
mm.
financial constraint were there. But now, last 9 months, we were not able to get it followed, doctor, once we moved to UK.
Oh, I see. We'll see how we can help you regarding that. There are other support systems we have in place. So now I want to ask about her development, other aspect of her development. Salma, as at now, is she able to run around like other children?
Yeah, doctor, she is able to run, she is able to climb stairs,
Oh,
climb
that's great.
up and down. She is able to
Okay,
do.
okay, she does that like an adult. She goes ups and down like adults.
Yeah,
Oh,
doctor,
okay.
she even like an adult, she goes without any support, she moves.
That's good. Is she able to dress herself?
Dress, yeah, doctor, she's
Okay,
able to dress herself.
okay, that's great. Can she hop, stand on one feet? Can she
Yeah,
hop?
she is able to stand on 1 feet for a while.
Oh,
She is
okay,
able to hop also on 1 feet.
okay, that's great. Is she has she gotten all her jobs?
Yeah, doctor, jabs, we have not taken, I think, all the jabs. That's why they said also the brain fever was because of not taking vaccine. After that, we have been taking regularly, doctor.
Okay, I see. Can you tell me about your family? Is there any other thing you want to tell me that I missed out?
Yeah, doctor, my wife is staying still in Middle East only with one more kid. The child is now 7 months. All are
Hmm.
fine only, doctor.
Okay. Is there any concern, anything you want me to address during this conversation?
Yeah, doctor, financially we are having trouble. We are because of that only I have moved to the UK, and almost I am able to spend everything, send the
Thank you.
savings.
Thank
So
you.
I'm
Thank you.
unable to do the follow-up properly. So I'm
Oh,
really
oh,
concerned about that, doctor.
okay. We'll see how we can help you. Thank you so much for taking to me. I would like to discuss with my examiner. Thank you so much.
Thank you, doctor.
Yes, please summarize.
Okay. Thank you. Today I took history from Ali, the father of Salma, who is a 4-year-old. She presented to the clinic as the father has concern regarding her speech. She has a background recurrent ear infection, and also she had meningitis-like illness around 2 years of age. As at that time, that's when they noticed her reduction in speech, and she is currently being followed up by the neurologist. They are not keen with their immunization. There is also issue with her financial constraint in area of development, and for her fine motor and gross motor, she is developmentally around 4 years of age. I would like to proceed to assess her other domains.
Okay. Yeah. So we'll proceed with the assessment.
Okay.
Okay. That's yeah.
Okay, yeah, I've already taken permission from the parents. So I sanitize my hand as I enter the room. I'm looking at Salma from afar. I'm trying to observe how is she? Is she well grown for her age?
Yeah, she seems thin for her age.
Okay, that's good. Is there any obvious dysmorphic features I could see?
No,
Okay. Is there any devices? Is she having ergometer or any hearing aids?
no,
Okay. Is there any other devices of daily living around her?
no.
Okay, that's fine. So I pick up my tools that I want to assess her. I took the book, I saw the tools, I've already taken it. So I now as I approach the room, how is she? Is she aware, unconscious of my arrival, or she's not interested?
She's just sitting next to her father and playing with some toys.
Okay, that's great. So I went through her bag and said, "Hello, I'm Salma," in a normal tone. Did she hear me?
No.
Okay, I increase my voice. I say, "Salma." Did she hear me now?
Yeah, she startles, but she doesn't know where to look around.
Oh, she startled. Okay, okay, right.
Can hear
Okay,
your voice, but she doesn't know. She's not able to locate the voice.
okay. I tried to check in both ears. Were they equal?
Same response
I
in both.
Okay, okay.
Able to hear you
That's
very
fine.
loud, but she's not able to locate your voice.
Okay, okay. So I now squat down around her level, and I try to engage her. I'm speaking in a loud voice. I say, Salma, my name is Kabir. What is your name?
She looks at you, she smiles, and then she looks at her father.
Okay. So there was no response. Sorry? There was
Yeah,
no
she looks
response.
at her father. She looks at her father.
Okay, okay. I tried to give her a toy. I told her, okay, this is a cup. Can you hold it for me? Was she able to do that?
You are giving what?
I just gave her a toy, like one of the toys.
Okay. Yeah, she is able to hold it.
Okay, she was able to hold it. So now I'm trying to assess the receptive language. I told her, Salma, please can we come down and play with this set of toys? Did she join me to play?
You're asking in normal voice, or you're being
No,
loud?
I'm still raising my voice.
You're
I can't hear you,
sorry, I
network.
couldn't hear you. My network
Sorry,
is yeah, once again, I'll
sorry.
try to comment.
Okay, okay,
Yeah, I am pausing your
okay. Sorry, she seems frozen. Is it only me or it's everyone?
Yeah, yeah, some connectivity issues.
yes,
Okay,
now is it clear?
Yeah, ma.
okay.
Yeah.
Okay.
Yes, I
So
can.
I asked it holding a toy, and then he wanted to assess receptive hearing.
Oh, oh, yes, yes.
Yeah.
I brought some toys. I want us to play. Did she join me to play?
Yeah, she is joining you to play.
Okay, so that's great. So I put some set of toys. I asked her to show me which one is the cup. Did she show me?
Sorry, I couldn't hear you. Am I audible to you?
Yes, you are very audible. I don't know if it's only me. Okay, I asked her which one is the cup. Did she show me which one is the cup?
So yeah, she's
Cup.
able to point to car. Yeah,
Okay.
she's able to point to the car.
Okay, so now I'm assessing if she knows what I told her which I keep cup, spoon, and a car. I asked her which one do we eat with? Did she show the spoon for me?
Yeah, she's showing.
Okay, that's great. So I now asked her to, can you pick the spoon and put it inside the cup? Did she do that?
Yes, she is able to do it.
Okay, that's great. So now I asked her, I asked her which one, sorry. Yeah, so now I asked her, can you put the spoon inside the cup and give it to daddy? Was she able to do that?
Yeah, she is able to do that.
Oh, that's great. So I now asked her, three colors. There is blue, black, and red color. I asked her which one is red. Was she able to show me red?
Yes, she is able to show.
Okay, that's fine. So I now also try to assess a complex command for her. I told her, put the spoon inside the cup, take it on, put it under the table, and go to mommy. Was she able to do that?
You're trying to ask me three-step commands. Is it three-step
Yes.
commands?
Yeah, three-step command.
Yeah.
Was she able to? Okay. That's okay. So now I'm trying to assess the expressive language. So I to asked her what's her age. Was she able to tell me her age?
Oh.
Okay, no age. Okay. So I asked the father at home, does she have any words? How many words does she have? How many words?
Does she have any?
Words.
Words does she?
Yes.
Okay. She can probably talk one or two words with meaning.
Okay, with meaning. Okay. So okay. So I also asked the dad that at home, what is she having any repetition of word like echolalia?
No.
Okay. So I also try to assess her at home, her social. Is she able to is she dry at night?
Yeah,
I'm trying to
she
assess her
is.
toilet habits. Yes, okay. So I asked about her play. Does she play with her does she play in group with other children?
No, she doesn't.
She doesn't. Okay. So if I took a doll, I gave her with a brush, I asked her, can we comb this doll? Was she able to do that? Trying to
Yeah.
imaginative play.
Yeah, she's able to do that.
Okay, that's great. So I also asked at home, was she able to feed with fork and spoon?
No.
Okay, so how about using of spoon?
Yes, she can.
Okay. So I now try to dressing the clothing, playing, lesson. Okay, I asked if at home she's able to dress and undress herself. Is she able to do that?
She can dress
Mm.
like when someone is wearing, she'll help. When
Okay.
someone is putting on, she can help.
Okay. So I think I'm done with my assessments.
Okay. If you want to summarize, you can proceed.
Oh, okay, yes, I want to summarize. Okay, so today I assess Salma. Can you hear me, please?
Yeah, yes, I can.
Okay, so today I assess Salma, who is a 4-year-old child with concerns regarding her speech. In the area of she was well grown. She was interactive throughout the assessment. She doesn't have any obvious dysmorphic features. She's appropriate for her age and weight. In the area of her speech, in her receptive language, she's she's appropriate for her age at around 4 years of age, as she was able to demonstrate. She was able to demonstrate three-step commands and more. She was also able to demonstrate adjectives, which is around 3 years of age. In the area of her expressive language, she's delayed for around I will put her around 18 months, 12 to 18 months, because she could only have few words. She could not tell her name. She could not tell her age. So I will place her expressive around 12 to 18 months of age. In the area of social development, she's around 3 to 4 years of age, as she's able to demonstrate playing. She's also able to dress herself. However, she was not able to demonstrate use of fork and spoon. So I will think of her having an isolated speech delay, which is more of on the expressive language.
Okay. So you took 2 minutes to summarize, but for practice reason, I'll just extend the time of your discussion. So what all do you think are the issues that Salma has? Will you list the issues that Salma has?
Okay, yes. In the history, I got that she had meningitis-like illness. She also had jaundice at neonatal age. She has financial issues. They use two language. They are Arabic native speakers. They recently moved to English speaking country, so that might contribute to her speech delay. And I also there was also issue of immunization at home. Yeah.
Okay. So what are the examination that you would like to do in Salma?
Okay, yes, I would like to take detailed history and also examine her. I would like to perform formal audiological and visual assessments. I will also like to do basic lab investigations such as the blocker and differential, and also perform EUCR and electrolytes. More importantly for this child, I would like to do refer her to an ENT surgeon, and also for refer her to an audiologist for ear assessment. Regarding her language delay, this child will immensely benefit from the help of speech and language therapists. Although she's already seeing one, I would like to assess what has been done, if there is need for other intervention. Overall, her management will involve a multidisciplinary approach with the community pediatrician at the center of the management. She will also need to bring in social worker here, because the father brought out the issue of real financial distress. I would like to also assess if there is any schooling plan for her, as maybe this child will need special adjustment at school or at home, or maybe she might need an educational healthcare plan. But I think she will just need more of special school needs. Also other team that will help in her assessment, in her management, are the occupational therapists, and also she will need possibly occupational therapist, more importantly.
All right, time up. Thank you.
This is quite tough.
Okay, so how did you feel like you did it? What are your thoughts about your performance?
Honestly, I used to think it's a bit easy because I've always not been on hotspots. But this is the kind of, I think, the first time I attempted development, and it was different. Whatever I have on my head is not easy to translate it to action. So I guess I need more practice. And then my history,
Yeah,
I think.
and you definitely need practice. The more you practice for development, the
Mm,
more you'll get confident and you'll get the flow. Because especially with milestones, you'll get stuck. Isn't it? What's next? What's next? What's next? You're at 4 years, so what to do? So only if you practice, you'll get the flow to practice.
yeah.
Yeah. Okay. So anyone else wants to add anything? Yes. Okay, we'll start with the role players feedback first. Dr. Balaji, sir, if you're free, if you're available, if you can give your feedback on the history part.
Okay. I think the Kabir
So,
did more mature way of presentation. I think what the examiner will look into is whether you have an approach. So that part, I think Kabir tried to show the approach. So he was systematic right from the start, and he tried to ask all the questions. Feedback means, Kabir, did you ask about the fine motor in the history? So that was the question. Are you there, Kabir?
Yes, I was asking if she was able to dress herself in the history.
But the fine motor is about the hands, right? What they write, what they draw, and
Okay.
at least cubes. The simple. You have to ask two questions. So, what does the child do with the cubes? So that
Mm,
you could have closed down the question. So, fine motor was an issue actually, because it's a development station, no? So they expect you to take few questions in the gross and fine in the history, then assess the other domains. So they will look whether it's a global developmental delay or not. So that part they will expect. Then,
okay.
whenever cognitive comes, no, so in the history, behavioral is a very important part. So, did you ask anything related to behavioral issues? Like it could be an autistic spectrum, right?
Right.
So, so that part. And in the end, I think you are very fast in the final part because time, that's the problem with development. So it's suddenly it's from 13 minutes in history, you are back with 9 minutes. So you have to
Mm,
balance your questions because here the social history is very important both in development as well as somehow you have to squeeze in the time. So
mm,
education, I think education you didn't touch, right? So education, and is there anything which I missed? So there I brought up the financial issue. Actually, you didn't ask the financial issues, but somehow I am a helping role player. So I wanted to help you with the financial part. So somehow you have to balance the time. So that's my feedback. But otherwise, the approach I really enjoyed the way how you asked. So you are organized. It's just the balancing part. So in the 9 minutes, you have to address all.
mm, okay. Thank you so much, sir. Thank you very much.
Thank you.
If you have anything else to add also, sir. Like,
You add, man, the assessment part, you would have noted, you add.
so anyways, I'll start from history. I also have a few points to add in. You introduced yourself, you asked how the father is doing, you tried to develop rapport, all that was very good. You wanted to get permission to take notes of whatever you're asking, that is also good. And then you started with, tell me in your own words, what are your main concerns? That is also very good. So with development, even with history station, the easiest way to get into what they are actually trying to tell you is ask them what are your main concerns. So then you'll get about 4-5 sentence stories so that from that you can build upon. So that you did. Yes. And then like vision and hearing you asked, but then what you didn't ask is whether it was formally tested. Like vision, he himself said that vision was not formally tested. But that has to be a part of the question there. Yes, and then when you go into cognition, like Sir already said, you have to ask about behavioral concerns. If there are any concerns with the child's behavior, if there is any rigid routine that the child is preferring to, or if the child prefers any specific toys, does the child make any eye contact? Whatever the parents have observed, those will have to come in history. Obviously, you cannot ask about milestones in history when you talk about speech and social and assessment. But then these parts will contribute to your diagnosis, because these days development station is not just that, isn't it? These days it is neurodevelopmental station. They want you to find the etiology, and then they want you to discuss what all multidisciplinary team that you'll involve. So analyzing that part is important. So we had a few hidden agendas that you did. Sorry.
Yeah, sorry, regarding that behavior, because I was asked to perform cognitive assessment, so I took it in part of assessment. I didn't want to ask the question in history so that
These
it will
can
not.
be asked. These should actually be asked, because you're trying with abnormal movements. You're trying to rule out Rett syndrome, which you cannot do in assessment because you'll only be checking milestones. And when you ask for eye contact and like, you cannot do that in assessment, isn't it? You can probably
Okay.
ask if the child is interacting with you, but you want to
Mm.
see whether the child is sticking to a rigid routine, whether the child prefers any specific toy that you cannot do in assessment. So those you can ask only in history.
Okay, thank you.
Yeah. And then usually a background of the main concerns, what you ask will give you more clues, is whether the child had any fever or any rashes or any trauma history.
Mm.
Okay, those can add a few points. And then you did ask if there was any loss of skill or developmental regression, history for developmental regression, which was good. And then you did ask language confusion, because this is the father's main concern was speech, which is also good. And then you went into past history, and the role player was good. So he told everything about meningitis, antibiotics, recurrent ear infections, requiring antibiotics for that, everything. Yes. But one thing that you missed was whether any formal hearing assessment was done after the meningitis, because meningitis itself can cause sensory neural hearing loss. And the drugs, because you asked specifically which drug was given, gentamicin or amikacin, those aminoglycosides itself can cause hearing loss. So usually they do about 30% of cases with meningitis result in hearing loss. Either pneumococcal meningitis or H influenza meningitis. And that's why the father gave you a clue also that they haven't been regular with vaccination.
Mm.
The hearing assessment after the meningitis event is important, whether it was done.
Okay,
Based
thank
on that,
you.
you would got an idea. Yeah. So then perinatal, you covered torch infections, and then yes, jaundice was there, but then it wasn't significant enough because father just said that it was only phototherapy. It was only there for a day or two. Had it been high enough to cause kernicterus, the patient would have stayed longer, or there would have been alternate treatments like exchange transfusion or prolonged treatment phototherapy after that. So those history would have given a clue for. I know you put that in issues for energy. Of course, you should keep that in mind. But then contributing factor to connectors would have been those positive history for that would have been those. So then, if you usually what we'll say is after this, ask the father or the parent itself whether they feel if they feel the child's face is different from their own, syndromic issues, and whether they feel the child's head is small. Post meningitis, sometimes there won't be much of brain growth, so they can still have the head that they had at 2 years of age. There won't be much growth. So those can help you. And then since this is cognition assessment, you will have to ask about screen time, because screen time can be a contributory factor to delayed speech. And if any affection of sleep is there, or any affection of activity is there, again, that will give you clues about other factors. The child is away from mother, and the child is only being taken care of nanny. After that, the father only takes care. So obviously the child's food intake will be affected. The child's sleep will be affected. Those are all issues that you will have to list down. So you actually miss those points. The social history, like Dr. Balaji said, being away from the mother is an important issue that needs to be addressed. That emotional effect that can contribute to the speech delay, the social delay, those will have to be addressed. Since we didn't have much time, I couldn't dwell deep into those, asking you what do you think is the cause for the delay. Anyways, you listed out the issues, so due to lack of time, we couldn't discuss much. So then when you ask a family, you will also have to ask if there is any similar condition in the family. For example, Rett syndrome can be inherited, though it's very rare, but then has an inheritance. So that is also, so that one line is important. I know it's too cramped to fit into 9 minutes, but then they expect everything in those 9 minutes. Yeah. And then if you can possibly do a quick system screen, because already CNS and hearing was affected. So if anything else was affected, just a quick system screen. Each system screen. I know again it is difficult to put in. So what we'll usually say is once you get a brief history, before going into social, family, the multidisciplinary team, the treatment part, you can probably finish off developmental milestones, because when I was timing, you only started it at 7 minutes. You have only had 2 minutes left. So you had to rush through the developmental milestone. But then in development station, you telling age for each of the milestone is very important, both in history and in assessment. Because like I already said, it's a neurodevelopmental station. You want to tell whether it's GDD or it's only isolated affection of one milestone, or I mean one domain, so that you can list causes and then you can treat accordingly. Because all those comes into discussion. So multidisciplinary team, you asked who they are following up. Father said that he's lost to follow up ever since he moved to UK. But then when you summarized, you said that they are in follow up with the neurologist, which is not what is happening.
Oh, I missed that part. Yes.
Yeah, that's why it will help when you take notes here and there. You know, the more you practice, you'll be able to do all that. Yes. And then you didn't ask whether the child is on any medications currently. Because the father said that the child threw a seizure when the child had meningitis. You didn't ask if the child is on any anti-epileptics or any other medicines and whether there is complaints to it.
Okay. He gave history of recurrent ear infection, not seizures.
No, he said there was seizure when there was meningitis.
Okay, yeah. I thought it resolved. Okay.
Okay. Yeah. So then going on to the social part, I think I covered family. School, you didn't ask, like Sarah already said, but the child had not joined school. So that again will come into your multidisciplinary team, your issues. The child has not gone to school at 4 years of age. Whether the child has any special educational healthcare plan. So then you'll involve a special educator nursing coordinator for that. In your multidisciplinary team. And then financially, he said that, he said that they are not doing well. So then you said you'll involve a social worker, which is very good. Vaccines, he himself said that they have, you asked whether vaccination was done, and then he said it, we haven't been regular with it. So that again gave clue for meningitis, and then you thinking of sensory neural hearing loss because of that. And then the usual, whether the child's food, how the child is eating. So the father would have said, child is not eating properly now, probably, and your cause can be because the child is away from the mother for almost 9 months. Obviously, 4-year-old needs their mother. Otherwise, I think you covered everything in history. Just that you used, I remember only one jargon term, whether the birth was term delivery or not. I think that is a jargon.
Sorry, say that again.
Whether the birth was a term delivery or a preterm delivery.
Yeah.
Yeah, that's a jargon. So that's the only one that I can remember. If anyone else found anything else, please add in chat so that we are all only learning.
I tried to correct it by saying 9 months.
Okay. So red flags. So whenever you are taking history, the most important thing is you write down red flags so that you'll remember to ask. So autism, Rett syndrome. The issues that I had was meningitis. The drug that used during meningitis could have contributed to the hearing loss. Recurrent ear infections contributing to hearing loss. And then language confusion. There was increased screen time, about 4 hours per day. And then the child is away from mother, which affects her emotionally. So the emotional effect is also a contributing factor. And the hearing assessment is not done, which means we don't know whether the child's hearing is normal, and like till history, I'm saying. And then by assessment, you also come to know that the child's hearing is affected because child only responded to you when you were loud. So then in your summary, I said that you confused with that follow-up thing. Otherwise, I think your summary was good. But I probably I missed it. But then in summary, I don't think you told the milestones. I mean, age for gross and fine motor. Or did you say that the child is appropriate for age through gross and fine?
Yes,
That
I
is,
mentioned.
you mentioned. Okay, I probably missed it. Okay, so then moving on to assessment, you used hand sanitizer. You already introduced yourself to father and developed rapport, so you don't have to repeat that. Then you check for the child's growth. I said the child is thin for age, but you said child is appropriate for age while summarizing.
I thought you said it's normal for age. Okay.
Okay, and then you could have probably asked the size of head because the main concern was CNS infection. So you could have probably asked about size of head. You asked about dysmorphism, good. I said no. And then you asked for any devices, which is also good. I said no devices because I didn't want to give a clue that the child's hearing loss. So I said there's no devices around. So then you asked, what is she doing? That's good. Like she was sitting, you asked whether you attracted the child's attention. Yes, I said the child is just doing her own toys, which means she couldn't hear you coming. And then you could have probably asked just one more question. How does she look to you? Like, does she look well kept? Well kept? Because that can be a sign of neglect, which can again be a contributing factor for delay in milestones. Because this is speech and social cognition, all these are contributing factors. So then you did the hearing test, you did the whisper test, you went back, you whispered, child did respond, you talked louder. So probably here, you could have involved the father. The child might better respond to someone who she knows than someone who she doesn't know, especially in a country far away from her home country and from her mother. She would have been more comfortable because when you asked her name, she didn't say anything. She just looked at her father. Maybe had you asked the father to ask her to tell the name, she probably would have told.
Mm.
Okay. Otherwise, I think you covered everything in receptive. You wanted her to recognize pictures and toys, which she did. She was able to tell verbs. She was able to tell colors, which all put her receptive in at 3 years. Yes. And you also said 3 years. Then expressive, you can probably use a toy because it will, or a doll because it will attract her attention better. See, this is a doll. The doll's name is so and so. You can even use your own name. This is Kabir. What is your name? So then that will make her more interactive and she might actually respond to you better. Because it's the first time that you're meeting and interacting with her. She doesn't always have to respond to you well. That is why every time when you summarize, you will say it as this time when I examined her, this was the developmental age that I could assess because that may not be true, the true assessment.
Yes,
Okay,
yes.
that's why when you say a multidisciplinary team, you will say that you wanted to do a formal developmental assessment first with a developmental pediatrician. Okay, is this too much info or?
No,
Okay.
it's making sense. Thank you so much. Yeah.
All right. So then you asked if there is echolalia, which is good that you observed it. And then I'm not sure if you asked eye contact. I don't think you asked eye contact because you are doing social assessment.
I didn't ask.
Yeah. So that has to be asked. So all those observation things has to be done at the start. Whether the child is making eye contact when you sat, because you sat at the level of the child's eye level, isn't it? That's what you said when I came inside.
Yes.
So you should see whether the child is able to make contact. And then when you're observing her, you didn't see for any ringing movements, hand ringing movements, suggestive of Rett syndrome. Okay, so that will also have to be done. So I kept the social age at around 2 to 3 years because child can only use spoon for eating, not able to use spoon and fork together. And then child could comb the hair of a doll, which means the child can do imaginary play, which again puts her age at 2 years.
Yes. Yeah.
Or it will be 2 to 2.5, isn't it? Because we can only give a span of 6 months after 2 years. Not 2 to
But she was almost dry by night, which puts her at 3.5 years. So you can say 2 to 3 years. That's okay.
Can we give a span of 1
And
year? That's the question. After 2 years, can we give an age spanning 1 year, 2 to 3 years, or just 6 months, 2.5 to 3 years, or
okay.
2 to
So the concept. Yeah. So the concept here is that some of the social milestones that has gotten delayed in her is mainly because of her hearing, because otherwise there's no other reason for her social delay here, isn't it? So some of her milestones she was able to attain, like she has almost become dry by night, and she can dress with help. It only depends on the issue that we are facing. But when she has to go and play with another kid, she's not able to do. because of her hearing issues, she is not able to interact well. But she can do imaginary play by herself. When she has to play by herself, she's able to do that.
What questions can we ask for imaginative play, pretend play, cooperative play, associative play? Can you tell me?
Yeah, I'll post it in group soon. Which all questions you can ask for developmental milestones that I can post in group.
Okay, thank you.
Yeah.
I think 6 months range we have to give. Better to give 6 months range, and less than 1 year, 3 months range to give.
So while we assessing social milestone, we have to ask to father or parents that is able to do all the milestones, or we have to assess.
No, social, most of it you cannot make them perform in front of you. So you will ask it as history during the assessment part, not during the history part.
Okay.
Because you won't have a bunch of friends around to find out whether she can do group play when she's 4 to 5 years of age. So those all will come in history. And undressing them in front of you is not advisable, isn't it? So dressing and undressing, you can still ask as history.
Okay.
And all those brushing teeth, using toilet, those all will come in history.
Thank you.
Yeah, thank you. Okay, do we have any other doubts or anything else to discuss? All right. Thanks everyone for joining today. I
Sorry,
hope
please, can you do the assessment for me? Let me see.
Sorry.
Can you do the assessment for me? Let me see how I've done.
Then it will become a class, which I don't want to bore you guys with classes.
No, not. I mean, scoring.
Oh, the scoring. Okay, yeah, I'll do that. Okay, yeah, sorry. So the screen is visible, yes?
Yes.
Okay. Yeah. So information gathering and history taking, it was all very neat, very structured. I think you covered most of it. You just missed 1 or 2 points. But then one of them was a very important point, isn't it? Because you had to talk about behavioral concerns to rule out. You had a confusion whether to do that in history or assessment. And you couldn't cover much of the social history here. The school part, the impact on the father, the impact on the child, how they are dealing with it. So I'll probably give you 1 mark there just to be strict so that you
Yes,
improve better. Yes.
yes.
Physical examination, I think you did everything. You asked everything that needed to be asked. Identification of clinical signs, yes, you picked up all the clinical signs. You were able to tell the developmental age appropriately. Clinical reasoning, you were able to discuss all the issues. But you didn't address a few social issues, isn't it? Away from mother and emotional affect. And then screen time, those social concerns were not addressed when you listed the issues because you weren't able to elicit some of those history. So I'll probably give you 1 mark there. Management planning, I think you covered almost every multidisciplinary team that has to be involved. You just forgot formal developmental assessment, but I'm not reducing marks for that. Tap on communication style was good. You were able to address the father's concerns. You were responding to his concerns. You were trying to pacify him with reassuring words. All that was good. So yeah.
Thank you so much.
I've just reduced 2 marks here and there.
Thank you so much. I really enjoyed it.
Thank you.
Yeah, I would have also given 10 plus.
Thank you so much, Prof.
Actually, it's a development is a biased station. So although it looks too much, the way you do the assessment will give you the marks.
More marks.
The assessment you are doing with the examiner straight
Mm.
away. So that is the place where you're going to score your marks. So
Okay.
rest all things, the way you do the assessment, no? So the examiner should get convinced that this guy has practiced, he is doing it in a systematic way. Even if you are a bit ahead or behind the developmental age, still you will get the marks. Because the structure, how you are doing that only the matters. Because when we did the exam, when we came out, one was saying one developmental range, the other was saying the other range, but still all got good marks. So I feel there is a bias in that. So,
Because there's about 6 marks of the entire assessment for just assessment part. You have 4 marks for history and just 2 marks for the last management planning and discussion part. So if you concentrate more on the assessment, if you get the flow with doing all the milestones, then you can probably score because you have 6 marks there. And just doing rapport and communication, you can probably get 3 out of 4 for history. And if you discuss for the entire 3 minutes, they are bound to give you at least 1 mark for management planning. So it's all about knowing where to crack which station.
Yeah.
Yeah. Okay.
I think
Thank
that's
you.
what I really need practice.
Huh?
Thank you.
Thank you. Yes, thank you.
I feel one place where we should be careful is with nanny part. So it could be a potential case for. So here the child is not speaking and they have mood, but I think the chronology might help you out. Hello, are you there? Are you there?
Yeah, it's echoing.
Are you there? Hello.
Yes, sir.
Hello.
Yeah. Am I audible?
So just the part, the abuse part, we should be very careful. Here, nanny is there, mom is not there, father is going to work out, child is not speaking well. Chronology might help us out. Like it has been like 2 years and they have moved, but still we have to be, the interaction with the nanny needs to be evaluated further. That can be discussed actually. Okay. Thank you.
Thank you.
Yeah, thank you. Thank you, everyone. If there is no further discussion or doubts, we can probably end the session. We'll come back with another session next week. Thank you.
Thank you, ma'am.
Yeah, thank you.
Yeah. Thank you so much for wonderful session.
Thank you, ma'am.